Hello, my name is Tamara Donahoe, and I'm from University City, Missouri. And I was in line with the first group, and once they said, that was the end of that group, and I got here a little late, so I didn't hear all the groups. And they said, oh, this group couldn't talk, and there's going to be another group to be able to talk. And I thought, really, I'm for healthcare reform, okay? I think everybody here will agree that what we want is good health. Okay? And that's not necessarily that we have to have insurance. What we want is affordable health care. Okay? And the fact that our government officials have been able to divide and conquer us, get us pitted against each other, Democrat versus Republican, or whoever, what the Democrats have proposed or what Republicans have proposed, is just to our detriment. They've got health care. Okay? For us, what we want is good health. And the issue is that good health care has become too expensive for most people to be able to afford. And what's been kind of glossed over, or actually it's been veiled, is the fact that it's the insurance industry. It's lawsuit abuse. It's the insurance companies overcharging people and then not giving the money back to the people, putting it into foundations that they control and can then use to get more money for, or more power for the insurance companies. It's the pharmaceutical companies making drugs that are, astronomically expensive. It's those things that are causing healthcare to be too expensive for us to afford. What needs to be reformed is healthcare and the cost of it. Tort reform needs to be done. And the lawsuit abuses. What needs to be done is for the insurance companies to stop overcharging people and stop getting the benefit of the government augmenting this whole skyrocketing of cost of healthcare. My mom is 80 years old. For the last 5 years, she lived with me. When I first got her here, she was near death. I'm a person who believes in alternative medicine. What I did was help her get herself more and more strong through using alternative methods. The doctor that we went to is an internist, internal medicine doctor, and she's also a natural care doctor. And she used her knowledge of disease and what she knew about alternative methods to help me get my mom healthy. And one of the things that we did is my mom had a sore that would not heal on her foot. And this doctor told me, you can go through Medicare, and what they will do is they will require you to use every other alternative, every other method, including drugs, including amputation, before they allow your mom to get hyperbaric oxygen treatment. But if you take your mom to a freestanding center and get her hyperbaric oxygen treatment for that sore that wouldn't heal, it will heal. And you won't have to be like a patient that I have whose mother was scheduled for amputation. And I had to convince her to take her mom to get hyperbaric oxygen treatment. And right before the operation, this lady did, and it healed her mom's legs. So what we need is things that work, things that give us health, things that help us improve our health. And so this bill has nothing in it about providing hyperbaric oxygen treatment. Hyperbaric oxygen treatment is good for stroke. It will heal damage from stroke. It is good for Alzheimer's. It will heal damage to the brain. It is good for traumatic brain injury. And this has been known since the 70s. If you want to not have our healthcare system be taxed by the baby boomers, and I heard somebody else say that, it's we baby boomers who are going to have to pay for this healthcare thing that's going to be provided to our parents. No, this is directed at us. us baby boomers, because the people who are providing health care see that this big influx of people needing health care is getting ready to hit. So this euthanasia of elderly, which is what it is, which is what my mom is now going through, because she got in the hands of the medical system, and they will now not allow her to get the alternative treatments that helped her get healthy over these last 5 years. I left her at the nursing home where she is now, which I do not want her to be in. I left her tonight because I am that passionate about getting my views heard. What we need is something that's going to bring about true health, not a burden to every person here to pay for something that is not going to bring about health, but only bring about more and more and more debt. Debt for our country, debt for each and every one of us. So what I want is, I don't want the system that they have now, the bill that they have now. Scrap it and start to build something that actually is going to provide health. People aren't going to fight for insurance. Oh, I want somebody to pay for me to have insurance, if what they really have is an option for true health. So that's what I want our Congress to be working on. Thank you.
I couldn't tell how many folks were still in line, so I just wanted to check.
Just a couple.
Okay.
My name's Tom, and I have a question for the crowd that's still here. Is the government so enough that they can't run the system, or are they going to run it so well that it's going to put the health insurance out of business? Because the health insurance companies are doing a pretty good job right now as far as, turning profit. United Healthcare is up 155%, even in the midst of this economic downturn. I honestly don't know, when you talk about the public option, that it's going to crowd out private insurance. I mean, Medicare doesn't even crowd out private insurance. There's still Medicare gap insurance in that. But I don't know what it is. The government either can't run it, so the health insurance companies have nothing to worry about, or the government's going to run it better, cheaper, and then everybody wins. So, and do you know why fire engine trucks are red? It's because they're socialists.